All right, good morning, everybody. Now that you're all here, some of this will be repeat for others, but I'm Chris with United Agencies across the hall. This is open enrollment for the firm, and everybody will have their plans go into effect December 1st for whatever changes you decide to make. I appreciate you all attending this online with me. I had a cold and I didn't want to share it, so thank you for going through all that. Sorry about the difficulties. It actually helped me fix one of our own technical difficulties in the process. So what you're going to want to do is look in your inbox, your email inbox, and you're going to want to find the EASE email that was sent to you. So everybody received an email from EASE this morning, and in that email, it will give you a click link. This is our new technology that we are using for enrollment this year. So as I covered earlier just a second ago, we are not changing any of the benefits. So Blue Shield remains our medical carrier, MetLife remains our vision carrier, and then Unum takes care of everything from dental, life, disability, long-term care, including our EAP. So we managed to renew everything as is, but we all still do need to go into the platform and make your election for coverage. So I'm going to go ahead and hope this works. I'm going to log in. When you first log in, you're going to be shown a screen that has the logo of the firm, and then it's going to ask you to set your password. That password is creating your own personal portal, and your own personal portal is going to have all the coverages you pick, but also all of the documents or forms that go with those coverages. So it's really, really helpful, because at that point in time, when you finally need to see what you have for coverage or get access to, some of the costs and whatnot that are there, then you're going to be able to do that. And you're now going to be able to do that on an EASE app. So if you download the EASE app and sync your personal password and login information with that, you'll have right there ready access anytime you're needing this kind of information. And so once you're done setting your personal portal, then you're going to go ahead and click Start Enrollment, and we're going to see if this goes. So some of this is going to look familiar. It's not very much different than what we used to have, but there are some things that did change. So I'm going to go ahead and click Start. It's going to ask you to verify all of your information so that we do this thing accurately. We brought over from Employee Navigator, the system before, all the information and brought it over. But if we didn't bring over some information, then that's going to be problematic. So apparently the date of hire is not brought over. So we're going to need to administratively set all the data hires before you're going to be able to go through that. But that was the hang up just now. So just verify your birth date's correct. Make sure your address is correct. This is where all the information gets sent to, and then click Continue. And then it's going to then take you to your dependent information. These are your eligible dependents. And so eligible dependents include the spouse or domestic partner, as well as any child you're the legal guardian for under the age of 26. So if they're eligible, you want to list them. You can always waive the coverage for them when it comes to that point. Then you're going to click Continue, and it's going to take us to our first benefit it highlights. And in this case, it's highlighting for us the employee assistance plan that is paid for 100% by the firm. So you don't have any cost here. You can see pay period biweekly cost, it's zero, but it is going to show us what we get as a benefit. And they are all listed all the way down here. So varying contributions are being made to each one. You're going to want to select, excuse me, you're going to want to check the box on this one for everybody in your family, because everybody gets this at no charge. By being an employee of the firm, your whole household is eligible to receive this benefit. And then this benefit shows right here the benefit summary that goes with it. So you can click on that link and it'll immediately take you. So if you're sitting there and you're having struggles, or you're dealing with something and you need help, you can click on the app and this form will be there at any time. So instead of waiting and trying to struggle through something like emotional stress or whatnot, then you can come in here and you'll see, you can find the phone number for the services available. You can find some information on the website. They have great resources that can help you with a whole lot of things. And it's one plan that is just underutilized, I believe, but it's unlimited, confidential, 24 hours a day, 7 days a week. Very, very helpful services when you're at like a time where things just aren't going really well for you. So please make sure we take advantage of looking for that. So when you're electing coverage, this is a simple one because everybody gets it and everybody gets it free. You simply click continue. And when you click continue, fingers crossed, you'll go to the next page. Oh, there it did it. All right, very good. So now we're on the medical plans and the coverages that are there. And so what you're going to do is you're going to sign up or waive medical coverage. So for instance, when I sign up for myself, it's going to then populate for me the cost to me. And the way our plans are set up, we have the same sponsored HMO plan as our base plan. And then everything else that is less expensive of that will be free. But if it's more expensive, then you pick up the remainder of the cost. So we can see here, $27.06 is the remainder of that cost on that plan, $8.81 for this gold plan. So depending on who you enroll and how many people you enroll and what age they are, that's going to be a differentiator. So if I needed to enroll my wife, for instance, then you'll see that the costs do go up because the cost for dependents, that is our cost to pick up. If I wanted to waive coverage, I'm then going to give the reason why she's waiving coverage. Like for instance, she has her own coverage at her own job. They're going to ask, well, what coverage is that? And I'm going to say it's Blue Cross, and the group number, I don't know it by heart, but I'm going to make one up, and that's it. But I am required to cover my daughter. I need to make sure she has the coverage and I have the best options for her. So then you can see her costs do populate as well. So that's how the medical enrollment works. The thing I want to show you though is when you get to the plans that you're interested in. For instance, let's just take a quick look at one of the, well, let's find the one that will get covered. There's a lot of coverages, but you can see each one has its own benefit summaries. You can come in here, you can click the summary of benefits, just like we did on the previous one. And this form now will become available to you at all times. And this is where you can see, okay, there's my deductible. There's the pharmacy network I have eligibility to. Here's my out-of-pocket maximums. It comes in here and it gives you, here's what your copays are for an in-network provider. This is an HMO plan, so it only has in-network providers. And so all of that information is ready at your fingertips. This is where you can see the discounts that are available. By being a member with Blue Shield, we have access to fitness and exercise discounts, weight management programs. There's some alternative care discounts as long as you're using the network listed. So acupuncture, chiropractic services, therapeutic massage services, those are all in there. We have hearing aid discounts available, as well as some other health and wellness products that are available. So all of these things are now listed in one easy fashion here where we can get access to these kind of programs. On top of that, I mentioned Wellvolution earlier. Wellvolution is a wellness program that all Blue Shield members have access to. And so you can see there's a number of things. Here's your mail order drug formularies. Here's some health management programs if you're working through a condition that needs some of that extra support. And then there's enhanced wellness programs that are available to us under the Wellvolution platform. So it's going to ask you to take a survey. What is the thing I'm looking to do? Do I want to reverse existing conditions, lose some weight, manage my stress, improve my sleep, be more active? All of these things are available to us as members under the Blue Shield platform. And so as long as you register yourself for mybluecard.com and get yourself registered on the Blue Shield website, you have access to all of these resources that are free because we're members within Blue Shield. So they're not free, we pay for Blue Shield, but all of that's there. Here's where you would look up providers. Here's where you see what is covered under a preventive care exam. And then lastly, here's the Teladoc flyer that helps you link your Blue Shield plan with Teladoc so that you can have access to virtual care in minutes at no extra charge. So every one of our plans comes with a general medical visit or even mental health visits available through Teladoc at no extra charge. And you'll actually be connected with a provider that can help you through all of those things. And so that's the platform and how it works. You're going to then make your selection of benefits. So I'm going to go ahead and select the plan here that is the sponsored plan. Again, you have access to PPO plans, you have access to HMO plans. You have access to the Access Plus HMO network, which is the largest HMO network in California. And then you also have access to the Trio network, which saves you a little money out of your paycheck, but it's a slightly reduced network of physicians. So I've selected my plan. It tells me what my pay period cost is going to be because I've also enrolled my daughter. I then need to scroll all the way to the bottom. There's a lot of plans to choose from. In this case, it's going to ask me to give my primary care physician because I have chosen a HMO plan. But if I don't care who they assign to me, I can click auto assign, which is what I'm going to do for the purpose of this, just because it takes time to look all that up. I'm going to click auto assign and I'm going to click continue. So auto assign doesn't mean you're going to get the provider you already have. That means they're going to give you a new provider based on what availability is in your area. So if you do have an existing provider that you want to see, you definitely want to put that information in the system. And then it takes you to the next plan, dental, HMO, and PPO, and so forth. So it's a great system. If you have any questions, any problems along the way, you can get support from Ease itself, the company themselves, or you can come across or call us at our end, and we can give you the help you need. So I'm going to close out that, and we're going to start the PowerPoint presentation again because there's a lot better summarization I can do this way than that way. All right, so hopefully we can see that. And so we're going to go through benefits open enrollment. As I mentioned, this is all going into effect December 1st. So any changes you make today, they will be set up for a December 1st effective date. So the first thing we're going to talk about on our end here is Blue Shield Medical. So there's a number of plans being enrolled in. I've selected just 3 for the purpose of example. But we have the HMO plan, we have the PPO traditional coverage, and we have HSA or the savings plans that are PPOs as well. And all of those plans are available. With the firm, you guys actually have people enrolled in any of 16 plans right now. So 3 here, 1 there, 1 there. You all get to select what fits your needs the best. And so we'll go through this. So on the HMO plan, most of them don't have any changes to any coverages at all. So just to kind of walk you through what that looks like, right here on the HMO, the renewing coverage is the same as what we had before. It's got no deductible. It's got no coinsurance because everything's a copay instead of a coinsurance. Coinsurance is when you're paying a percentage of the cost. It's got the same $20 primary care physician visit. It's got the same $40 specialist visit. It's the same $500 when I'm admitted to the hospital. I pay $500 and it covers my whole duration of stay. And then it also has the same very, very low out-of-pocket maximum of $1,900. And so that's as I accumulate my expenses throughout the year and make my copays. Once I hit $1,900, I don't pay any more money for the rest of the calendar year. And it is a calendar year, it's January to December. So we've already been accumulating in this year. And in December, you'll still be in this year. January 1st is when the calendar year begins again, and you'll start a new out-of-pocket maximum. Same thing with deductibles in that scenario. If I go to urgent care on this plan, it's $20 instead of going to the ER, which is a bigger copay, and it's the same cost. And then Blue Shield runs 3 main tiers of drugs. You've got tier 1, which is typically generics, tier 2, which is brand name drugs that are in a formulary list that they like, and then tier 3 are the drugs that are brand name or other that are non-formulary, they're in the non-preferred list. So on this plan, the copays stay very low. It's $5, $15, or $25 for those drugs. And then within Blue Shield plans, all of them also have a tier 4, or really what it's called is specialty drugs category. And those come with an accelerated cost, but they all come with a cap, never to be more than $250 per month. So per prescription per month. So that's the limiter that keeps us from being overcharged for some of these very, very, very expensive medications. So that's the HMO in a summary. So you have Access Plus, which is the full network. So when you see the name Access Plus in there, that means you're getting all of the HMO physicians. When you're seeing Trio, that means you're getting a reduced list, and the reduction will take away places like Cedars-Sinai. It will take away places like UCLA as medical centers. So Make sure that you look for your doctor, make sure that you tell them or look which one they fit in, and then that's the one you want to select. So that's the HMO. The PPO plan works a little different. The PPO plan has in and out of network doctors. And you'll want to look at the PPO plans more specifically because some of them do have a change to what you were used to in your deductible. Sometimes it gets better. So for instance, last year, this gold PPO plan had a $1,200 deductible and a $2,400 out of network deductible. They've actually reduced it when they refiled it with the Affordable Care Act plans this year. They reduced it to $1,000 and $2,000. So not everything gets downgraded. Sometimes they get upgraded. So just look for what changes from you had last year on your ID card when you're looking through the plans. The way a PPO plan works, you're in charge of where you go. So if I choose to go to an in-network provider for non-emergency care, then that's where I'm going to get the maximum savings. If I choose to go to an out-of-network provider or a non-contracted provider for any of my non-emergency care, then I'm not going to have a lot of coverage. I'm going to pay greater portions of the cost of all of the services because they're not contracted. So you want to try to stay in network where you can. We have the full network PPO, so we have access to all of the providers that are available in the Blue Shield PPO platform. If I go to a doctor, I don't pay a deductible. You can see it says deductible waived where it's primary care or specialist. If I go to urgent care, my deductible is waived. I don't pay that deductible for those services. Where I would pay this $1,000 deductible, for instance, on this gold full PPO 1,000 plan, is when I see a physician in hospital, when I'm in hospital, when I have outpatient surgery at a hospital or an ambulatory center, or if I go to an emergency room. Those are the times when I'm going to be required to meet the first $1,000 for myself in the calendar year, and then I get to experience coinsurance at 20%, where they pay 80% of the negotiated rate and I pay 20% of the balance left. And all of that's accumulating to an out-of-pocket maximum on the gold level plan. So gold, silver, and bronze have much higher out-of-pocket maximum. Platinums is where we keep that down. So gold, silver plans and bronze plans, this plan has an $8,150 out-of-pocket maximum. So that's my larger accumulator. Remember, the platinum plan had a $1,900, much lower, meaning I would have no copays after $1,900. In this case, I have to accumulate my copays to $8,150 before I get to experience no copays for the rest of the calendar year. And then when I take my tier 1 drugs on this plan, it's $10 for that, and they waive the drug deductible. So this plan comes with its own separate $300 brand name or tier 2, 3 drug deductible, and tier 2 and 3, the prices have stayed the same, $40 or $70. So that's a traditional PPO. I can go in, I can go out of network, and I only pay the deductible for certain items. Now, if I decide I want to go to the savings plan, and you'll see that listed here, the savings plan, it's still a PPO, it's still the full network, but this one qualifies for a health savings account. So an HSA plan is what we refer to these as. In this case, the silver full PPO savings 2100 25% plan, what that's denoting is that you have to meet as an individual $2,100 before anything is covered. So doctor visits, everything includes deductibles. So everything must have the deductible met before you receive any services at that coinsurance level of 25%. So as an individual, it's $2,100. If I'm an individual with family, then once the family meets $2,800 in that deductible, then we're all set and we're all covered for that year. So it's a little bit different. Each of these plans has that nuance built in. But again, if I need to go see a, excuse me, a physician, I have to meet the deductible first. Excuse me.
And Chris, I got another computer trying to get in. Can you let them in?
Oh, sorry. Yes. Sorry. Thank you.
Thank you.
If I meet the deductible first, then I get the 25% coinsurance for those kinds of services. Same thing with medications. I have to meet the deductible first before I get to pay the copays that go with those medications. So a lot going on in this plan. It does have a lower out-of-pocket maximum though than that other PPO plan. It's only $6,900, and that includes the deductible that you paid, the $2,100 or the $2,800 that would have been your cost. So any questions? Let's check just to make sure. Looks like we're having no questions right now on the medical coverages. So you have the opportunity to elect any of the plans that are listed. Again, HMO Full Network Access Plus, HMO Limited Network Trio, and then all of the full network PPO or PPO savings plans. So all of those are available to all of you to make your election. Please go through the Ease platform. You're going to do that to find the plan that you want. And so I don't see anything in the chat bar, but we'll go ahead and go forward. And then at the end, I'll stick around for any questions that are wanted after the recording. Here's a question. To confirm, when I select the plan I want and I select current provider, do I need to enter their name? It helps if you enter their name because that way we make sure you're getting matched up with exactly what you had. So that would be a help. The more information you put in there actually is more helpful than not. Yeah, but this will not change your provider. So if you select current provider and it lets you go forward, because I think that's part of the problem, is it's going to require some of that information. It won't change. This is not going to auto change at Blue Shield. Any providers, we actually have to request that for you. But it is helpful if you list all of that information in there so that we make sure that there isn't any errors made. And then there's a question, what's the main difference between the Access HMO 030 and the 020? Well, let's go back to the platform for that. So I think it's worthwhile for sure to see that. So the 020 that we just went through, you saw had very, very low costs and copays as well as out-of-pocket maximums. But if we come in here and we look at the 030, for instance, so let's find it. It's a gold level HMO. There's 1,000. There it is. So if I look at the benefit summary for the 030, you're going to see that while it doesn't have a deductible, it does have a much larger out-of-pocket maximum. So instead of being $1,900, its maximum is $6,750. And then the $30 is now my new doctor visit, 55 instead of 40 is my specialist visit. And then when I get into major services, for instance, I'm looking for inpatient hospital, instead of it being a $500 flat amount copay for as long as I'm in a hospital stay, this plan actually has a $600 per day hospital copay up to 5 days in the hospital. So I will pay $600 each day for up to 5 days. On my 6th day, I don't pay anymore, but that could be a $3,000 hospital visit now instead of being just that flat 500. So that's one of the major differences is the out-of-pocket maximum, the hospitalization, and then lastly, when we get to the drug coverage, you're going to see that the copays over there were 5 and 15. Now it's 15, 35, 55. And then here's that tier 4 example that we talked about, 20% of your cost, but never more than $250 a prescription. So those are the major differences for the difference between the gold level HMO and the platinum level HMO 030 and 020. When we look at the platinum versions of these plans, it's less obvious the differences, and I'll try to get there. There's the trio levels. So here's the 020 platinum. To look at the difference between that and the 030 platinum, and I covered both because I didn't see a designation. You'll see this one, not as big a difference. This one's out-of-pocket maximum, instead of being $1,900, it only goes up to $2,700. And when I look at the cost for services, it's a $30 copay for a doctor, $50 copay for a specialist visit. And when I get into that major medical, it's $500 instead of $600 a day. And instead of it being up to 5 days, it's only up to 4 days. So those are the major nuances that change between the two. When I get to the drugs, you'll see it also comes with the more expensive drug copay system, unless I'm sorry, it's a little bit. Oh wait, I was looking at the wrong pharmacy. That's 90-day supply. It's about the same copay for the medications as the 020. Sorry. So hopefully that helped answer that question for you. And it comes with a less cost. So that's the other thing, is it's $77.34 for myself and my daughter instead of $94.26 in my scenario. All right. So let's go back then to the presentation, and we can take a look at the next benefit, which is dental. So this didn't change at all. So there's no change in cost. There's no change in coverages, no change in networks or anything like that. So everything stays exactly the same. And in this plan, we have two choices. You have an HMO dental plan, and this is where the app would become very, very handy. If you're at the dentist is explaining to you that we need to do a cleaning, and that cleaning is going to cost $120. You can show them right here, pulling up the information. Well, I have a code D1110 that's a cleaning for an adult. I get it every 6 months, and the cost is $0 for that. Or maybe you're getting into restorative, like getting a filling done or something like that. Well, when they tell you the cost, it needs to line up with one of these codes, one of these descriptions, and one of these copays. Otherwise, it's not being covered by your insurance because they're billing you outside of the contract that you have with your insurance provider, and that they are under with your insurance provider. Because you've gone to an HMO dentist, they have entered in a contract to agree to charge these charges by having you as a patient. So it's a very important thing to have this on hand. When the costs start to get bigger, say we're looking at a crown and it's 2750 porcelain fused to high noble metal, you're going to only pay $400 for that crown if the dentist does it under the system that you have, under the coverage that you have. But if they go and bill outside of that, they decide to bill you a 2749, there isn't a 2749 covered by the plan, so they can just bill you whatever they want. So it's very important on the dental HMO to be really proactive with the dentist and explain, I have this is my list of benefits. There's 400 plus benefits listed. Can you tell me how it fits with what you're proceeding with as far as treatment? And then when we look at the other plan that we have, it's a slightly more expensive plan, but we have a dental PPO plan also available to us. And what this does is it opens up every dentist to our disposal. So we have opportunity to choose in-network providers, and we have an opportunity to choose people who don't take my Unum dental plan. And that gives us access everywhere we want for dental coverage. The way this plan works, it has a benefit maximum. So every calendar year it resets, and your maximum benefit available to you is $5,000 on the Unum dental plan. And then there's a rollover feature I want to talk about next, but it could increase over time depending on how much we've used it. In that $5,000, if I go to Class B basic or Class C major services, I do have to pay a $50 deductible before I get the benefit of Unum picking up any of the cost. If I'm only going to Class A preventive services, though, I have 100% coverage at an in-network provider, meaning I will pay nothing for those services that are in that. And then if I go out of network, I do have to pay 20% of the cost for whatever the Class B service or Class A service is. And then when I get to Class B, I have 80% in-network, 50% coverage out of network. When I get to Class C, the major things, I have 50-50 coverage whether I'm in or out of network. And again, all of that, every time Unum makes a payment on my behalf, they're paying towards my $5,000 maximum. Once they've paid $5,000 for me as an individual or any other individual in my family, each one of us gets our own, then you have no insurance for yourself until January the next year. And so that's the coverage there. And then orthodontia, Class D, is also 50%, but it uses its own separate maximum. This is how the plan's classes list. So this flyer is available for PPO members to utilize. So under Class A preventive, it's got all of my cleanings, my routine exams, my x-rays once per 12 months. It's got information about emergency treatments. Everything I need on maintenance levels are in Class A. And then when I get to Class B, this is where you'll find fillings, simple teeth extractions, the anesthesia that's going to be covered, Any repairs of a crown, denture, or bridge fall into Class B. Endodontic coverage and crowns, bridges, dentures, and implants, they're in Class B. And then the only thing in Class C are inlays and onlays. So that's the layering of coverage. So this is a great plan because we moved a lot of major items into Class B, where you end up having more coverage if you're in network. And then Class D, the orthodontia, you can see it has its own separate lifetime maximum of $1,500. And that's the full benefit for orthodontia. And it's only eligible to dependent children up to age 19. So it's not like dependent children being eligible for coverage can go to age 26. The dental only orthodontia only covers them up to age 19. So any questions about dental before we move forward? Well, actually, one more item on it. There is a carryover benefit. So if I'm on the PPO plan, the HMO plan's unlimited, it has no maximum benefit. But if I'm on the PPO plan, I have $5,000 worth of coverage. Now, if I've only used less than $800 worth of cost, then they're going to carry over $400 of my unused benefit to the next year. So now I have $5,400. So if this year on this plan, we were, getting our cleanings done, maybe we had one filling or whatnot, and it was less than $800 that Unum paid out on my behalf, then I'm going to get an extra $400 added to my benefit maximum this coming year. And so now I have $5,400. And that can take place year over year over year up to a carryover amount limit of $1,500. And there are some rules to make sure that the money gets carried over. For instance, I must do certain things, like I must get one cleaning done at least a year. I must have one regular exam done. And I have to go through total dental claims for preventive, basic, and major covered procedures paid during the year below that threshold that I already talked about. So if I do all three of these things, then I'm eligible to get that rollover, and that rollover will carry over and be available to me. So a lot of good benefits in here. There are some questions that have come in. I want to take a moment and answer some of those. So the question that I see is, if I need an implant, would it make more sense to have PPO Class B, or would HMO cover more of the cost? The truth is, implants are very limited coverage, so either one is going to be equivalent, but I would definitely recommend the PPO in network as your best option to get access to an implant that will be covered. It's a difficult item to get covered. We just don't pay enough, and I know it sounds strange, we don't pay enough in monthly premium to cover the cost of these thousands of dollars implants that take place. So it is covered, it is in there as a coverage, but it is going to have a limiter to that. So I would recommend the PPO and definitely take that. When I signed up for Unum in September, there was no choice between HMO and PPO. My card says Network PPO, Dental Max Plus. I was told this was a PPO and I'm paying nothing, so it seems like something did change. No, it's been there. Maybe it wasn't listing for you. HMOs are there. They're less coverage. They're more affordable, and the coverage factor is definitely better on a PPO for network. And because your firm does pay a great amount of that cost, that does help. There's a question about the dental cost increasing. Currently, somebody's paying $11.80 for 6 cents for PPO dental, and for me and a spouse, it's gone up to 30.89. It actually didn't, so we'll have to figure out what's going on with that, because you did not receive increase. It's probably something not being noted right in the technology, unfortunately. So sorry, we'll get that fixed as soon as possible so that everybody's costs are accurate. And what I'll do is, after this call, everything that we do notice is wrong, I'll immediately take care of it, and then I'll let Brenda know that it's correct, and then everybody at that time, you'll be able to go in and sign in and see it at least as accurate. Okay, so we'll go forward. Yeah, it looks like there's some issues with some of the technology and costs that are in the system, so we'll have to make sure that's completely accurate. All right, well, tech glitches all through the morning here. All right, so let's talk about vision. I'll come back to other questions if I see them. So we have MetLife So a separate carrier for vision. And the reason we did this was MetLife has a feature, which is extra pair of glasses that was different than anybody else offering. And so we wanted to make sure we made that available. So you have through MetLife access to vision providers. The vision provider, you want to go on their website to find out who's in network. But when you go see an optometrist, you're going to pay $10 for your exam. You have, oh, sorry, my slide threw somebody off. Yeah, you're going to pay $10 for an exam, and that's going to be a comprehensive exam to set you up for eyewear. If you decide you would like extra screening, so a retinal exam, then you can pay up to $39. I'll let you know, I just had my eye exam done at Lens Crafters, and they didn't charge any of the extra cost for the retinal exam. So sometimes it will be $0, sometimes it might be up to $39. It just depends on the provider that you're at. And then with that exam, if you're in network, you're going to pay a $10 copay for your lenses as well. So single, lined bifocal, lined trifocal, and lenticular, those are what are only a $10 copay. If I decide to go to some more comprehensive lenses, which that's what I've done, I went with progressive. I went with a polycarbonate lens, and I paid extra for that feature, but I got a discount for that feature. So you'll see if I go to ultraviolet coating, that is covered in full. If I go to polycarbonate for a child, it's covered in full. But if I'm going as an adult, then I have multifocal, which is what I am, up to a $35 extra copay for that services. And then I have one extra pair of glasses I did get where I added a tint to it, where it changes color, darkness as I see light. And so there's extra copays for that as well. So depending on what extra feature you're looking for, you have a copay that goes with each one of those. And then when it comes to getting the frames, we have an allowance. So we paid our $10 copay for an exam. We paid our $10 copay for the lenses. We get an allowance for our frames, and that allowance is $120 towards the cost of frames. Now, if you pick a featured frame, which means it's a frame on sale, that could be a $140 allowance towards the featured frames. And then at Costco, Walmart, Sam's Club, it's a $65 allowance, and that's because they are already hyper reduced in cost, and so you're getting $65 towards that. If you decided you didn't want, oh, and then you also get 20% off any additional cost above that allowance. If you decided you wanted contact lenses instead of glasses, and you actually don't have to make that choice because of the extra glasses feature I'll talk about next, but you have a $120 allowance towards the cost of contact lenses. And the recommendation on that is to get them all at once. So you don't want to use this benefit periodically with contact lenses. You want to place your annual order all at once. And then there's a 20% discount off the cost of an additional pair of prescription glasses. There's questions coming in, and then I'll talk about the final one on this. Will my toddler get coverage for vision through Blue Shield, or do I need to enroll him on the MetLife plan? Great question. Thank you for bringing that up. If you're covering your child on, so a child 18 and under, on your medical insurance, Blue Shield has a pediatric vision and a pediatric dental benefit available to them. So you do not need to add children to your MetLife vision plan. They are covered if you have them covered on an Affordable Care Act plan. The way you can tell if it's an Affordable Care Act plan: platinum, gold, silver, bronze. And I say that because maybe you're getting your coverage for medical at a spouse's employer. If they don't have platinum, gold, silver, or bronze built into it, then pediatric vision and dental might not be built into their coverage. Another question is, if my dependent is non-binary and I select the gender of their birth, will it affect anything if their government listed gender is X? It won't, but I think that's a great point to bring up to ease, that they should update their system to make that election allowable. Appreciate the question. All right, the last feature there is 20% off your additional glasses. But what I want to point out is the bottom of this screen, which is an extra benefit that the firm purchased for you. And what that is you have an opportunity to get a second pair of glasses with lenses and frames in the same 12-month window. So you have two choices or three choices. You can get two pairs of prescription glasses. So this is what I did. I got the ones that I use for my daytime work in office, and then I got some that change and transition for when I'm outdoors. You can get one pair of glasses and an allowance towards contact lenses, which is what my wife did. She has glasses that she wears, but she's also wearing contact lenses. Or you can just get double the allowance. You can get $240 worth of contact lens allowance, whatever you decide. So the one little nuance, which is a little annoying, is the eyewear has to be purchased separately. So in order for this benefit to take place, you must make your appointment for your first eyewear, pick it out, have it purchased, and then unfortunately you have to come back again, go, you remember that prescription I had? Can I also get that now for the other glasses or contact lenses I want? So it's a weird nuance, but it's the way they are able to administrate it. So that's there. And then lastly, there is a discount program for LASIK coverage, and you just must go to a MetLife participating provider. So you'll need to look up on the MetLife Vision site who those providers are. I'm really appreciating the questions. You're giving me some great insight on what can be better and also what I need to fix. All right, any more questions on vision? Okay, now let's talk about the employee assistance plan. So again, I want to highlight it. If you're going through anything like a stress, depression, anxiety, family and parenting problems, you're having problems with grief or loss, job stress, work conflicts, relationship issues, all of those are available to be helped through the employee assistance plan. Other services do include, they have access to discounted services like childcare, elder care. Obviously, you are an attorney firm, but they do offer legal question support, identity theft support, financial services. So that maybe I need to build a budget, I have debt management issues that I need to work on, and there's just ways to negotiate and help you in a lot of things in your life that could be difficult. So it's convenient, it's available 24 hours, 7 days a week. It's not going to take care of you long term. So when you go in to see a person face to face, or you have a virtual visit face to face on an issue, you're going to get 3 visits covered. And after that 3rd visit, they're going to try and transition you or help you to either your Blue Shield support or whatever medical plan you have for like mental health services, or some community support that could benefit you. So that's the EAP plan. Again, 1-800-854-1446 is the phone number where you can access this support anytime you need. And let's click, there we go. And then that brings us to some of the darker insurances, if you will. So we've got long-term disability, short-term disability, long-term care, and life insurance. And so start with life insurance. I always ended on life insurance. I thought, well, that's how things end, but I figured I didn't want to end on life insurance. So we're going to talk about this one, and these policies do have some nuances that are different, and they call out whether it's for a class of employee, whether you're a partner, or in this case, all other employees that aren't partners. The only difference in this is employees that aren't partners, the firm is paying for your coverage. So that's a benefit. And the way this benefit works for the life insurance that we get, you get a 1 times earning up to a maximum of $100,000. That's the employer funded life insurance plan. And then if I'm looking at some of these other plans that are available to me, I have access to voluntary life insurance as well. So again, the way life insurance works, you get that 1 times annual salary up to that $100,000, or if you've purchased for yourself some of the add-on life insurance, you have access to that coverage. And in the event of a death caused by age or natural causes, or illness or natural causes, then because age is not a category for death, illness or natural causes, then it will pay that flat amount, that up to 100,000 one-time salary, or whatever the extra benefit is that you bought. If I have an accidental death, a death caused by an accident or an injury, then it's going to pay you twice as much towards your beneficiaries for that accidental death. And so if you wanted to buy additional insurance for yourself, this is the screen for that. You're allowed to choose from a $10,000 minimum amount in increments of $10,000 up to $500,000, but it can't exceed 5 times your earnings. So whatever your earnings, if I'm earning $60,000, then the maximum I can buy is $300,000 worth of insurance, because that's 5 times 60. So if this is your first time purchasing it and you were offered this before, it may not be guaranteed issue. But if you've already purchased some life insurance, you do have a guarantee issue amount up to $50,000 where no health questions are asked for yourself. That guarantee issue for your spouse goes up to $15,000, and then for children, it's $10,000. And the way this one works, and hopefully the technology will calculate it properly for you. It will by the time I'm done with the call today. Your cost is factored off of your age. And as we age into a new category, the cost does change at that time we renew that year. So for instance, I'm 54 years old right now. I'm at the end of the 50 to 54 category. I pay 19.7 cents per $1,000 of coverage to have this plan. And so every $10,000 I buy, it's going to cost me $1.97 for that coverage. Every time I buy 20, 30, it's all going to incrementally go up. Next year's renewal, if I was on your plan, I become the 55-year-old, and then I would have an increase in my cost at that time. So that's how this life insurance works. You have a rate for yourself, a rate for the spouse, and you'll see the spouse's rates are the same as yours. And then the rate for children is really low. It's 0.901 for 1,000. So $10,000 for your kids is 90 cents. So really, really great coverage to add on if you need extra life insurance. Not everybody needs extra life insurance, or any life insurance for that matter, but this is an opportunity to take advantage of that. The next benefits are our disability insurances. So we didn't die from our injury, but we're disabled, or we didn't die from our illness, but we can't continue to work anymore. This is what this coverage takes care of. And in this coverage, we have 3 categories. We have partners, associates, and then we have all of the other employees under that group. And the reason we do this is it is an income replacement plan. So it's 60% income replacement up to a weekly maximum on the short-term disability of either $2,771 or $1,501. I must be disabled or ill more than 60 days continuous. So that's a major key to this coverage is I have a 60-day elimination period. Once I've been off work and unable to work during that time, then I file my claim, and I can start to expect to see 60% of my income up to a maximum of $2,771 or a maximum of $1,501. And that will be paid to me weekly for 17 weeks. And the definition of disability is the California's definition of partial disabled. So that's the definition that they utilize. It requires 2 factors to not be eligible to be done, or it requires a inability to make my full earnings up to over 80% of my earnings. That makes me able to be listed as disabled. The scenario, if you're an associate or all other employees, the employer, the firm is funding it. Otherwise, if you're a partner, it's funded by yourselves. I'll take a pause here. Well, let me finish on this, and then we'll go back to the life questions. Then there's long-term disability. So after that 17 weeks I've been getting paid a weekly check for 17 weeks. What happens when I'm still disabled? Well, that's where this picks up then. In 90 days, elimination period, this is going to start bolstering what you have from your short-term disability policy. And so what you're going to see is you're going to have 60% coverage again, same coverage percentage, but now the amounts go up. I can get paid up to $12,000 or $6,500 of my monthly income on that disability. And so a very, very helpful benefit when we're missing our paycheck, when we can't make the bills that we would normally make. This helps us take care of the extra costs that we'll have while we're unable to work. There is a question related to, I applied for additional life insurance. Oh wait, here's the first one. If I missed this, I had to step away. Where do I get the beneficiary designation for our Vol Life and for our spouse life? So that will be listed or requested in the Unum or in the EASE platform. You will be expected to fill in your beneficiary information. If you want to find out what you had listed prior, we have all of that in our office. If you wanted to go across, we can pull up from the Employee Navigator site, or you can do it actually right now. It's not terminated, and see who your beneficiaries were that you had there. The other question was, I applied for additional life insurance, the max, on September 1st after filling out the long health questionnaire, which I turned in to Angela, and I've not received a response. So in September, you turned it in. So we just need to follow up on that to make sure that you pass the evidence of insurability. We usually get notified within 30 days of that request. So we'll have to follow up and find out what the delay is on that. I'll print the report of all these questions so that I make sure that we follow that through after the call. Thanks for that question. All right, let's move on. We now have the most complicated one to enroll in, which is long-term care. So I've highlighted in yellow. So this in the EASE format, if you're already enrolled in this, you do not need to complete this form again. But if you want to enroll in long-term care or additional long-term care, you will need to print out this form, fill it in, and you're going to want to bring that over to our office so that we could submit it for you. And the reason is this is not a benefit that's any more eligible to be sold as a new plan in the state of California on an employer deducted basis. But what we have is we are grandfathered in because the firm had bought this back before that became a law. So we don't have access to, it's not a law, but it's the carriers don't do it. We don't have access to this plan outside of a company that had this 20 years ago. So the long-term care plan, the way it works is you have the funded plan, which is the one that's paid for you. So what that plan gets you is it gets you nursing facility coverage 100%. It gets you 70% care coverage at a residential care facility. And then if you're at a home or a community-based care, you get 50% coverage at that facility. So depending on what your need is for your long-term care situation, there's going to be a varying level of coverage. And within that, you're going to also then only have a $3,000 benefit, monthly benefit for that care. So if I'm at a residential care facility, I'm going to have 70% coverage up to a maximum paid by Unum of $3,000. If you wanted to increase that, then that's where you're making an election to have more coverage for yourself. So if you want to increase it all the way up to $8,000, you're able to do that, but you have to pay the extra cost that goes with that. And there is a cost sheet that's also attached as a form in the EASE platform. Or again, just come over to our office. This is one of those things that I think it's good to sit and really consult on, much like when you're buying your own personal life insurance. You know, this is a bigger item and something that we would talk about. But just to give you the nuance, so you buy the plan that you want. So how much care do I want? You buy the monthly benefit that you want, and then you have a duration period that you're also purchasing. And so the firm has purchased a 3-year duration period, and that would be how long-term care would cover you. If you need it longer than that, it will expire. That's what that means. If you wanted a longer duration period, 6 years, then that would be a good idea. If you wanted to never have to worry about it, you want unlimited, there's a cost for that, but then you would have coverage until you passed away. So these are the carrying levels of this plan. One of the other things that's very important is Plan 3, Plan 4. They do come at an added cost, but what they have built into them is compound inflation. So what that means is as the cost of long-term care keeps going up, they're actually going to go against what that is and help the amount that you've earned be reduced so that or be increased so that you get more coverage. So it's a factoring that takes place as the cost of care for long-term care goes up. You're going to also want that care to go up with you. So those are the reasons to pay the extra money. Is there a question? Okay. So so that's the benefit as it is. It is available to all of you. You're automatically enrolled in Plan 1, 3,000, 3 years, but then the rest of it you do need to purchase as a voluntary buy-up as a payroll deducted plan. And so I've talked a lot about Angela. Here's Angela. If you ever need support throughout the year, please come across the hall or make a phone call or send an email to angela@ua-insurance.com. Again, I'm also available. Anybody who has a private question they'd like to talk to me about, please go ahead and call me. My cell phone, I'll just put it in the chat here, but you can call me and I'm happy to help. If I don't answer, please leave a message or text me and I will be sure to, oh, that just went to one person. Let me send it to all. Please be sure to let me know how I can help, and I would love to help. So let's see. Very clunky. All right, there we go. That's my cell phone. You have access to me anytime. I'm in the office, but not as much as Angela. So please feel free to reach out to me. With that, I'm going to go ahead and pause or cancel the recording, and then we can